All right, so we are now going to start an IV. Now, before we start an IV, I'm just going to say this patient's not looking too good. I'm kind of seeing some pallor. I can't really check orientation because he's just an arm. But luckily, this is a sim lab. So we are going to set up the IV line and start an IV. Normally, when you're going to start an IV, there's a reason you're starting it. A lot of times they want fluids, or maybe the patient's going to be getting antibiotics. I know in intensive care, every person that comes in has to have an IV regardless. If you're in ICU, you got to have, generally it's 2 IVs. So we are going to start an IV on this person. In your packets, you have little piggyback stuff and fluid bags. So you simply rip off the little port thing, stab it. Before you turn it up, you got to make sure it's off or clamped closed. Then you turn up. The next thing you got to do is you've got to get some fluid in here, because if you don't, you're going to have, if you just try to put the fluid through, it'll be some saline, air, all down the line. So you got to get some fluid in here. I generally fill mine about halfway up. Then, when you open, now I started nursing in pediatrics, and if there's one bubble, boy, those kids will cry like the dickens. So I always had to get every little bubble out of my line. So I just turn it upside down, and then I will, when the fluid comes down, I'll start flipping it and get all the air out of all the ports. And at all the sites, like here, I would have to flip here, but then the air would just go right out until you get to here. Then flip that out, and when it gets up to here, I clamp it. And then I go to my regular clamp, and I clamp it off. So now I can let go of that, and nothing will drain on the floor. Now, a lot of times we have what's called a piggyback. Now, notice how this is a big bag, and this is a little bag. This would be like your antibiotic bag. Now, what happens when you're giving somebody a piggyback ride? I wouldn't be giving a little midget a piggyback ride. Oh, I guess it's called a little person. Sorry, I don't want to get in no trouble being politically incorrect. Anyway, if I was going to give a little person a piggyback ride, that's how it would be. They wouldn't be giving me one because I'd break their back. So the little one always goes on top. There's a little thing that hangs this down low and puts this up high. So you always want the little guy on top. Oh, here's some stuff right here, I see. So this, and then we have a piggyback here. Now you spike this the same way. Notice how it's going to be up high. You can spike it the same way and get the fluids down to the end. Now you've got a decision to make. Because when you look at my tubing, notice I've got a port here. I've got this that is the regulator. And then a port way down here at the end. Now this will hook into your IV pump. So the way to think about this, the way to consider this and know you're right, because which port are you going to hook into? Well, this is going right into the patient. And if you hook in here, there's no regulation of what's going to go into the patient. Where this is before the pump. Hold on to that for me. Thank you. So this is before the pump. And if I hook into here, the pump's regulating it. That's how I'd remember it. So luckily, since this is a sim lab, you can take your alcohol swab, and if you rip it, you're going to be out of alcohol swab. So you just say, I'm going to alcohol swab this off. Then I would open up my tubing, take off the cap, and then I would just plug it right in. And you're ready to go. Unclamp. And you can even unclamp this one now because it's clamped by the IV pump. So I've got my tubing all ready to go. That's the first thing you've got to do is get your tubing ready. Now we're going to stick our patient. So what do I have to do? Well, of course, I have to do what you always have to do in the sim lab, and especially in real life when your nursing license is on the line. I'm going to simply check a doctor's order. Better be an order before you start an IV. Then I'm going to double check my fluids, what I'm going to infuse, that order. Then I'm going to walk to the bedside, and as I'm going to clean my hands, whether it's soap and water or the little hand sanitizer stuff. I'm going to get my hands cleaned. Then I'm going to check my patient ID, and I'm going to ask my patient their name. Then I am going to prepare my equipment. I'm going to make sure I've got adequate lighting, and I'm going to ensure patient privacy. Now I'm ready to begin. Now, a lot of these things, you just need to be prepared and know that you're going to always have to check for patient privacy and all that. So I've got my bed already at a working height. That's good for me. And so now I'm going to prepare my equipment. I've got a little piggyback line. Now this is the old style stuff that we used to use back when I started nursing in the 90s. It was for a needle to shoot in here. This is the needleless system. Now, I guess Ivy Tech gets these cheaper. That's why they don't get this already hooked on here, because we're trying to, save you money in your packet. So first things first, I'm going to open this, and notice I'm not going to touch down where the hub is because I don't want to contaminate it. I'm going to twist this off, discard that. And although my hands are not sterile, I did this in a sterile procedure way because I did not touch the connecting parts. So I know this is all sterile. Now I can begin, and I would throw that away. I can get my saline, and you can just, say this wherever, open the pack, hook it on. I'm going to flush until a drip comes out the end there. Now I know this is primed with saline. Now I don't want to touch the end of this because that's sterile and it's going to hook onto the hub. So what I always do, I guess I got to open this. What I always do is when I use this, I will take this, put it right there. Now I got a way that I can just grab it. I don't have to untwist that thing with blood dripping off. I just think it's faster and easier. So that's how I do mine. And I can lay that down there and know that the tip of that's going to be sterile. Now I need my inside angiocath, my IV start kit, and my gloves. I can use clean gloves so long as I don't touch the place that I'm actually sticking.